Broadcast is now starting. All attendees are in listen-only mode.
Good morning, folks. We're going to give just another minute for the webinar to fill out with folks who are attending. Great. Well, let's get started, everybody. Good morning and afternoon. On behalf of our colleagues at Data Across Sectors for Health and the Center for Healthcare Strategies, I'd like to welcome you to today's informational webinar. My name is Peter Eckert. I'm the co-director for DASH at the Illinois Public Health Institute. Next slide, please. For today's webinar, the audio is going to be mostly muted given the number of people on the call. You will have an opportunity to chat with the group of people on the call, and most importantly, you'll have an opportunity to ask questions. And so we're going to encourage you to ask questions at any point within the webinar. Some of your questions will be answered as we in the question box while we're in the webinar, and some will go into the FAQ portion. We're really going to try to split this up about half and half us talking to you and half collecting your questions and responding to them. Next slide, please, Susan. So on the call today are a bunch of folks from Data Across Sectors for Health and CHCS. Their names are all listed on this slide. Speaking today will be myself, Amanda, and Alyssa. I also want to recognize Susan Martinez and Miriam Castro from the DASH team who are helping with the technology and with navigating. And so you'll see and hear all of us in action today. Next slide. So as I said, we're going to do a quick introduction to DASH, CHCS, and then jump into the specifics related to the Learning and Action in Policy and Partnerships initiative. We're going to talk a little bit about the RFP itself and how to apply, and then we're going to jump to your questions. Not to spoil the ending, but it's really important for you to become familiar with the brochure, which I think a lot of folks have already seen, as well as the FAQ document that we'll be posting probably tomorrow. Most everything that you're interested in knowing will be available in the brochure, the online application system, and the FAQs. And I'd like to say specifically that DASH staff and CHCS staff will not be able to meet or discuss with you your ideas for your potential proposals. We just can't do it out of fairness for everyone else. But we will be very attentive to the FAQs. Next slide, please. So I don't know how familiar all of you are with Data Across Sectors for Health, but we are an initiative fully funded by the Robert Johnson Foundation, started a little over 5 years ago. We are a partnership between the Illinois Public Health Institute and the Michigan Public Health Institute. Next slide. My sense is that most of you on this call already understand what we mean when we talk about multi-sector collaboration. But we put the slide in here just to sort of put our stake in the ground, our flag in the ground, that when we talk about multi-sector work, we're really talking about a broad understanding of all the different sectors that have an impact on individual and community health. And so it's the kind of organizations that are represented here, really importantly, more involving community residents and people with lived experience. And even though it's not specifically recognized on this slide, also the participation of local and state government agencies, many of which are concerned with health outcomes. Next slide, please. So we're going to sit on this slide for a few minutes. This is going to do a lot of our work for us. So ever since DASH started, we focused on three things that we think about together. So we think about data and information sharing. We think about a multi-sector approach in the way that I just described, and we think about community collaboration. And we really believe that if you're able to have community organizations and leadership working together collaboratively in a multi-sector approach to work on collaboration and data sharing, eventually you're going to be building the capacity of communities to improve community health, well-being, and equity. And increasingly, we're talking about racial health equity. That's the focus. Those are kind of the inclusion criteria when we think about DASH programming. To talk about our strategies, we have always sort of followed three strategies. We want to build local capacity, and typically we do that with some of our grant making. We've supported in one way or another about 150 communities in our first 5 years. By working together and shadowing and monitoring what those communities do, we've been able to build the evidence base for what works and doesn't work with multi-sector collaboration and data sharing. So that's our second strategy. Our third strategy really recognizes that, A, we weren't the first ones on this beat. Lots of folks have been talking about a multi-sector approach to community health. And so we have always said that we want to be working in concert with others to kind of co-create the movement that sees collaboration and data sharing as part of how we increase local capacity. Now, we've been doing that for 5 years. And of course, one of the things that we've learned is that we cannot change the environment. We can't change the landscape, even with as many grants as we have given. And so we have increasingly started to understand that our work has to both support and be reflective of efforts towards policy and systems change. So for the last year or so, we've been doing some work with external consultants, and then more recently with our new partner, to try to understand where the specific levers are for collaboration and data sharing in communities. And so it's our understanding that if we can support policy and systems change, especially for communities that are earlier in their journey, that is a place where we can have a bigger impact than we could have solely with our grant making alone. And because of that, and because of our commitment to collaboration, we decided to partner with another organization to do this work. Next slide, please. We've been friends and colleagues with the Center for Healthcare Strategies for a number of years. CHCS is a grantee in some of their programs with Robert Wood Johnson in the same way that Data Across Sectors for Health is. And so when we were searching for some other organization that really had experience, had a reputation, had a set of network relationships, and honestly, folks that we wanted to work with, we reached out to the Center for Healthcare Strategies. And so Alyssa Beers on the call will be talking a little bit more about CHCS, but I imagine that a number of you are on this call specifically because you've been reached out to by them. And so we're really excited to be designing the LAPP program with CHCS, and also to be planning to execute our learning community with them. Next slide, please. So I'm going to try to keep with my allotted 10 minutes. I'll just rush through this. For those of you who don't know DASH, these are some of the ways that those three strategies I talked about are in action. And of course, you're here today because you're interested in the funding. But that funding is just kind of a step forward into a variety of different kind of things that we do. We do a lot of networking. We do a lot of learning activities, and I'm going to talk about that on the next 3 slides. Next slide, please. And even though you are here for the LAPP opportunity, I want to say that we do have another funding opportunity that is live right now, our KIC cohort program. DASH actually offers 3 different funding opportunities, LAPP, KIC, and our mentorship program. The mentorship program information will be available near the end of the year. But for right now, the community impact contracts request for proposals is open. And so you can get more information about that by going to our website at dashconnect.org/KIC, C-I-C. Those are shorter term and smaller grants, but they're really designed to do community capacity building in a very targeted way. Next slide, please. So I want to wrap up my time by talking really quickly about all-in data for community health. As I said, when DASH started this work, we looked around to see who else was doing it and identified a bunch of really great partners who also were very much concerned with those same 3 things. You know, community collaboration, a multi-sector approach, some attention to building capacity through data. And so right now, all-in data for community health comprises 7 major partners that are both national and state, many of whom bring communities into a learning collaboration. And that's what I'm going to close my section with. Next slide, please. All-in operates a robust learning collaboration. We do publications. We have an online community platform at community.allin.org. We support site visits. We do a lot of webinars. We just had a great one on racial health equity last week. And then we also convene meetings, both regional and national. So we'll talk some more about All-In if we have time, but I do want to say that All-In membership is a requirement for the grant, because you will be participating in the learning collaboration, and that collaboration will be hosted on the All-In platform. And with that, I'd like to send it to my colleague from CHCS, Alyssa Beers, who will talk specifically about this opportunity.
Wonderful. Thanks so much, Peter. And a huge thank you to all of the attendees that are on the line for being with us today to learn about this opportunity. My name is Alyssa Beers, and I work at the Center for Healthcare Strategies, as Peter just mentioned. And we're absolutely excited to have this time to talk with you all. Just to add a little bit more color to CHCS, for those of you on the line who are not familiar with us, we're a nonprofit policy center that is dedicated to improving health for low-income Americans. So our work focuses on 3 overarching bucket areas. One is around advancing delivery system and payment reform. One is around integrating services for individuals that have complex needs. And lastly, working to build Medicaid and cross-sector leadership capacity to support high quality and cost-effective care. So given DASH's experience and expertise in supporting hundreds of innovative community collaborations across the country to advance their capacity to share multi-sector community data, and CHCS's experience and expertise in working with states and other key stakeholders across the country to promote innovations in health policy through things like collaborative learning and technical assistance and capacity building efforts and overall sharing of best practices. We're just so excited to be partnered with DASH to support community and state partnerships to improve health, especially within communities at most risk of inequities. So as you see on this slide here, the aim of the LAPP effort is to enable communities to develop community and state partnerships to better inform inclusive policy and systems alignment at both the community and the state level. We know that there are so many innovations happening already at the local level, with communities testing new ways to improve health and advance equity by sharing data across systems and across sectors. In that same vein, we also recognize that in addition to leading data sharing efforts at a local level, community partners may also connect with state policymakers that have various tools and levers at their disposal to support these efforts to improve health, which I'll reference shortly on the next slide. So all that to say that our premise is that sharing data across sectors and building those relationships among community and state partners further can inform decision-making to improve community health and well-being and equity, and strengthen systems of care and break down those silos that have continued to perpetuate disparities in poor health. In terms of the activity, so this targeted support is intended to advance an existing and clearly defined project that aims to improve health, well-being, and equity through community-state partnerships across health, healthcare, and social services sectors. So the multi-sector slide that Peter was sharing earlier. Secondly, to build skills and capacity at the community level. So this includes building capacity to engage partners in support of data sharing or data integration efforts, the capacity to systematically share data across sectors, and or also to engage subject matter experts. So for instance, engaging legal supports or technology mapping expertise and so forth. And also to design and implement interventions that support community goals for improved health based on that multi-sector data. And thirdly, to build foundation for opportunities to identify statewide policy and systems change that drive more durable or sustainable outcomes aimed at directly improving the lives of those in the communities. There's also a non-exhaustive list of activities that the award and technical assistance could support within the RFP's brochure, which you have a link to on your screen. For instance, advancing the functionality and accessibility of existing multi-sector data systems, or adding a data source from a new sector. Another example might be to create a shared governance model between community and state partners to ensure equitable information sharing policies. Another example might be engaging community members or individual consultants or other collaborative experts to address a problem or to further advance your existing multi-data sharing effort. And what I would say is, I encourage everyone to reference that list within the brochure. However, we really do want to underscore that it is a non-exhaustive list, and we highly encourage creativity based on your existing efforts and what you see as unique opportunities for you to move the ball down the field, so to speak, for your effort. What we most care about is that LAPP awardees ultimately use the award funding for efforts that truly enable communities to strengthen and leverage state partnerships in support of data sharing efforts to improve health. So other concrete and creative proposals that reflect that overall purpose are very much encouraged. And so, of course, within the purpose of LAPP, there are a lot of different ways to go about this, data access being just one of them. And in the end, we certainly want to build communities' capacity to share data across sectors to improve health. So this slide essentially conveys that, again, there are various levers and tools that community partners and state policymakers have at their disposal to support these efforts to improve health, especially, again, within the communities that are most at risk of inequities. So, for example, data access, shared services and systems, interoperability rules, different financing innovations and opportunities, managed care organization contracting, and policy and legal clarity. Of course, we know that sharing data across sectors and building these relationships among communities and states is a unique opportunity to inform decision-making and ultimately improve community health. Next slide, please. So some folks on the line might be wondering, is this for me? Is this opportunity a good fit for my organization and our partners? I would say if you can answer yes to all of the bullets that are on this slide, then the answer is yes. In order to be eligible for the LAPP initiative, applicant organizations must either be public entities or nonprofit organizations that are tax exempt. Applicant organizations also must be based in the United States or its territories. Applications must include these 5 bullets, so a focus on building capacity of community collaborations, a clearly defined opportunity or problem that requires partnership among state and community partners, an existing multi-sector data sharing project. Again, this should not be in early concept phase. It should be an existing project that you have underway. A community collaboration that includes healthcare, public health, and at least one community-based social services sector. And lastly, a specific community engagement process for involving persons with lived experience as a partner in the planning and implementation and evaluation of this project. Next slide, please. So while the eligibility criteria was sort of a binary yes or no, these two next slides focus on the selection criteria, and we really view those as a way to underscore our priorities with you all. So I'm not going to read through each of these things, but I will simply highlight that these categories, principles, relationships, efficacy, and urgency, outline the things that are important to us. So for instance, we'll want to know that the applicant has familiarity with the principles and values of health equity and the importance of social determinants of health, that they have history of partnering with members of the community who share lived experience within the systems and supports that your collaboration seeks to improve, and that there's evidence that the proposed efforts respond to community needs. Further, we'll want to ensure that the applicant has the ability to execute a complex project, so we'll want to see a well-defined and articulated project plan and timeline with benchmarks for achieving those goals. As we're seeking to engage awardees as a cohort and to advance the field, we'll also be looking for a commitment to participate in group learning activities and contribute lessons broadly for including in the All-In network. Next slide, please. So applicants will have the opportunity to capture all of these priorities and how each of these factors into your partnerships and proposed project work within your responses to the application questions. So for instance, your organization's values and mission, you'll have the opportunity to describe your current project activities and how those relate to the priorities that you're seeing on the screen here. The proposed approach that you plan to use when taking this work forward, in addition to describing your leadership and partners' commitment to the work and advancing that. Next slide, please. So DASH and CHCS in partnership will facilitate a learning collaborative for the cohort of 5 awardees. We will deploy a variety of collaborative learning techniques to facilitate peer learning among the cohort participants and, of course, to promote emerging best practices in salient topic areas. So participants will have the opportunity to discuss, to share with one another, to learn from one another about innovative and effective approaches to bolster state and community partnerships in support of communities' access and use and integration of data to improve health. So the learning and collaborative approach will provide that sort of ongoing mechanism for the cohort awardees to tackle topics in a shared learning format while also having access to tailored and targeted guidance based on your specific project. And so participants, of course, as you see here, will have access to group learning opportunities, to targeted support through one-on-one conversations, as well as resources to share and leverage, including relevant articles and materials and learnings through the All-In network. And as this is a great segue to joining the All-In network, I am pleased to now turn it over to my colleague and partner at DASH, Amanda Kavanaugh, who will take the presentation on from here. So Amanda?
Thank you, Alyssa. This is Amanda Kavanaugh. I work with DASH. I'm one of the senior program managers focusing on health policy. And so in these next few slides, sort of going through more of the administrative steps for the process of applying, how to join the All-In Learning Collaborative. So you can access that via the site listed here. Just one more shout out to the handout section in the navigation panel on the right-hand side. You'll see a copy of this webinar. All of this data is in there. And then also the brochure is there in its entirety as well, which provides insights on these. But you'll go ahead and register and create your profile within the allinnData.org site. And then you will have an opportunity to complete the capacity assessment and work on some of the project questionnaires that will be part of that group, project group snapshot. So this is a great resource. It's a tremendous, not only for membership and for shared learnings and shared insights, but really sort of as a collective, learning from each other about these efforts and how we're advancing these core entities that DASH is focused on around health, equity, and well-being, and again, looking at sustainability for policy and systems change. So next slide, please. So the coup de grace, how to apply. So there is an online application system, and really everything that you need to be able to follow the LAPP and complete the steps are located on the DASH website. And so this dashconnect.org/LAPP, if I can make a pitch for a bookmark, I think it's a good one. And there's a link on that site to the online system, which is hosted by Robert Wood Johnson Foundation. So you'll see that pop up. And the application requirements, it's very easy to follow. It's an intuitive system, letting you know which fields need to be entered. You have the option to save and go back into the application as you work through the various parts of what you're putting together. You'll be able to go into different sections and enter that information and sort of follow that along as you move through the application process. There are a few sections you'll note on the application where you are required to upload documentation. And so you'll see that listed on the application questions themselves. In some cases, the supporting documents are suggestions, but there is a place at the end for some of the requirements that we do have around the financial statements, the letters of support, and things like that. You'll see that clearly where that's uploaded. Next slide, please. So the LAPP awards. The Learning in Action and Policy and Partnerships will culminate with 5 awardees. Each of those organizations will receive the $100,000 award, and the project duration is for 1 year. So again, on the LAPP homepage, you'll see this information, and in the brochure. The deadline for applications is 3:30 Eastern Time on December 16th. We purposely set it at 3:30 just in case there's any last minute issues that you may have or questions within the system to make sure things get entered. So if there's any reason for us to contact you at that point, we would have a window to do that. So that's good news. And also we don't anticipate there being any issues at all, but we always want to be mindful of that because we know you'll put a lot of work into putting it together, and we want to make sure we get that. And then in January 2021, the awardees will be notified. And then in the January-February timeframe, we'll be doing the contract initiation and getting those I's dotted and T's crossed. So next slide, please. So 8 tips for successful application submission. I just want to reiterate something that Peter mentioned at the top of the call. There are 3 primary sources to consider as part of the application itself and coming into what the selection criteria are and what the requirements look like. So again, the brochure on the LAPP homepage as well as in the handouts today, the RWJF online system, the application system is very intuitive. It has a lot of sort of how-tos for questions that may require some additional insight. And then also the FAQs, which will be coming out by Wednesday, the 28th. So Wednesday of this week will be great sources for this. But yeah, let's be mindful, 3:30 Eastern for the deadline. And if you do have any issues, within the online system, you can contact info@dashconnect.org. And please make sure you include LAPP program in the subject line. That is monitored regularly. Make sure that you complete your application online instead of offline, which is, I think that tool, having worked in this space for a while, is very intuitive and easy to use. So leverage that and let it make this an easy process for you. And make sure you submit your application in advance of the deadline. And then last but not least, next slide. make sure that you are, when you're in the system, not creating a duplicate application. Make sure that you're following the steps and, you know, sort of guiding that through the process. You'll enter the information in the application system. You can use the save button, which I mentioned, to, you know, if you finished a section or you want to go back to it or edit, you can still do all of that while you're in the pre-submit mode. So I know sometimes in a system it's like, oh, did I just click send? But it's very intuitive in terms of when you're ready to click that for final submission. And make sure that you have a backup person lined up. So just in case of worst case scenario planning, which 2020 has made everyone adept at that, I think, just making sure there's someone as a backup person if you are submitting on things around the deadline of that nature. So one more slide. Yeah, so we'll dive right into questions. I'll hand it back over to Peter, who will MC this portion, and thank you very much.
Thanks, Amanda, and thanks, Alyssa, and thanks, Susan, for keeping the slides going. I have tried to answer some of the initial questions that have come up in the question box so far. I want to encourage you to continue offering more questions. One of the things, because LAPP is a brand new program, we have not created an FAQ document yet. And so you will all define those questions, and we will work as much as we can to respond. As I put into the chat, some of these questions will require us to drop back for a second and talk amongst ourselves, because I want to make sure that we issue a documentation that are responses that make sense to everybody on the team. Great questions. And so I'm going to give a heads up to Alyssa. Alyssa, I'm going to ask you in a second to answer the question about policy change objectives, and you keep it as you are able. And I'm going to try to respond to a question that that 2 or 3 of you have already started to ask, and that's really sort of what's the specific requirement to work with state government. And it's been asked really 2 or 3 different ways. And so let me offer this. One of the things that we know from our work with DASH and the other funding programs that we have is that a key, probably the key foundational element of success is related to the nature of relationships between community partners. And we know that authentic relationships take time to build. And just like any relationship, you need to go through some work in order to really get to the point where you trust each other and know what each other needs. And so, those relationships have to be in place in order to do something meaningful. So when we talk about the kind of commitments from state agencies, what we're really, we don't want to be prescriptive in that respect. What we want to say is the 1-year term of this grant is not enough time for community or states to build relationships if they don't already have them. And so when you review the guidance in the brochure, it's explicitly clear about building on existing relationships. And so there will be other opportunities to build relationships under DASH funding that may be a part of our mentorship program. That certainly could be a focus for the KIC that's also available. But in your application, in your proposal, you would want to be able to speak compellingly about an existing relationship. And honestly, my guess is you probably know whether you have one or not. Trying to answer the question about when we say state, are we talking about a specific agency such as Medicaid agency, mental health authority, housing authority, or child welfare? Yes, that's exactly what we're talking about. One of the answers to your question, which I hope is not frustrating, is that we have the experience that we have is that data sharing work, collaborative work in local communities is usually fairly locally driven. And so we don't have as much experience about what it looks like when local communities work with their states. And so we've tried to cast the net fairly wide in terms of recognizing which state government entities might be partnered with local community collaborations. In part because our understanding of a multi-sector approach means that, lots of different departments, even those that are typically a part of health and human services, but also, lots of other sectors, like housing, like education, like parks and recreation. So we don't want to restrict the understanding of state government too finely. Really, the thing that we'll be looking for in terms of the state-local relationship is evidence that there's something real that's been happening that you're going to be building on or extending. I will put a fine point on that when we document this for the written FAQs. But thank you for all of those questions. I appreciate that it's a complicated piece of this. I wanted to toss it to Alyssa now that you've had a chance to compose what the answer would be for the question about defining policy change objectives.
So Peter, unfortunately, I am not able to view the question, so I'm actually wondering if you might read it aloud to me.
That is a problem for which I'm sorry. So let me answer the question. Can you further define policy change objectives? Could it be policy implementation models that promote best practices?
So I think, yes, it certainly could be policy implementation models. It also could be a situation in which the state is involved as a partner to advance community level multi-sector data sharing to improve health that fits within a broader policy umbrella that the state is hoping to advance. So it could even be within the design phase, but they want to be, proactively and roll up your sleeves in partnership with communities to advance policy design objectives in addition to implementation. I don't know if that helps, that we're thinking about this broadly, as Peter mentioned, in terms of some of the most pressing priorities for both state government and pressing priorities from the communities in which we're focusing these efforts and the capacity building.
Thanks. I think that's a perfect answer. Amanda, I'm going to go to you with a lightning round of kind of basic getting to know LAPP program questions. And I want to reiterate that we will answer in writing every question asked. And so all of your questions matter, and they inform not just you, but everybody else who will be interested in the program. So Amanda, is this a new funding program?
Mm-hmm. Yes, so this is a new project for the DASH organization. The Learning in Action and Policy and Partnerships is a new grant that has been put together, and so we are very delighted at the opportunity to kind of focus specifically in this area of state, community, and a community experience. And so it's very exciting for us and builds on the history that both organizations have developed thus far. So lessons learned, key insights we've had from state engagement, from community engagement, and really sort of try to figure out, in moving the needle on health, equity, and well-being, what considerations did we take into account where there have either been obstacles or challenges in place, or there have been new opportunities that have come to light, or there are some synchronicity that can be worked on in terms of data or legal elements to multi-sector data sharing. So it is a new opportunity for DASH.
And Amanda, is there a fee for joining all in?
That is a great question. And Peter, I'm going to let you answer that question.
Oh, there is no fee for joining All In. All In is open to everyone. As I said during that section of the presentation, a lot of community organizations and leaders are a part of All In because they are funded by a national program like DASH or BUILD, the Build Health Challenge. And so there's a lot of communities that are there because of that, but any individual person or members of an individual local collaboration can join All In for free. The only expectation and hope is that you will participate in the learning collaboration, because the collaboration is built under the idea that the wisdom to solve each other's problems is in the room.
Thanks, Peter. The garbage truck went by, so I appreciate that.
Sure. There's a question here about how many applicants do you expect to get? And the answer is we don't know. 200 people registered for today's webinar. It looks like at the high, we were about 165. We will have a question at the end when we close the webinar. How likely are you to apply? We've been doing grant making programs for over 5 years, but this is a new program, and so we don't know how many people will apply. We do know that the requirement for an existing state community relationship is really important, and I think both on this webinar now and in the brochure, that's a very clear expectation. And so, you know, that may be kind of the winnowing factor. And so we'll have to see. Wow, so many questions. These are really great. I'm going to read this question in full because I think it's really an important one. 2 other considerations about state and local partnerships. Can regional MCOs qualify as a state agency, since in many cases, local cross-driven initiatives can be driven by MCOs as a bridge to state partnership? Also, what about state-supported public-private partnerships, like state HIEs that are not run directly out of a state agency? And some state HIEs are actually run by a state agency, and in many states they are not. This could cause HIE partnerships to qualify in some states and not to qualify in others. So I think this is a question that we're going to have to spend a little bit of time answering. And so look to the FAQ in a couple of days for a final answer. The key here, I think, and certainly I think you'll be seeing this as you get more deeply into both the brochure and then as you engage with the online application system, is that, you know, our general idea is that we understand that there are levers that state governments have that are not available to any individual community. And so really, this is the why of LAPP. We want to tap into the different kinds of levers that state governments have on behalf of their communities so that we can make more changes in more places. So having said that, you know, state HIEs, state MCO vendors are definitely a part of this mix. And so in this case, the question would probably become who is eligible to apply, because certainly MCOs are a crucial part of making changes in communities in the same way that state HIEs are crucial for their states. But remember, please, that what we're looking for is the interplay, the interchange between community collaboration and these entities that have a relationship to states, so that we are illuminating policy opportunities that are really dependent on state power. So I don't know if that's helpful enough. On this and in every other question, please ask additional questions if you don't find the answers that we are giving today specific enough. I'd like to read this question. Is there a cost sharing or matching requirement? There is no cost sharing or matching requirement in this, in the LAPP application. If you review the selection criteria, you'll see that we do reference the fact that we do positively view your ability to use this, the LAPP funds to satisfy a matching criteria or use the LAPP funds to leverage other money. That is said within the caveat that the grant is 12 months long. And so those opportunities for leverage need to be in front of you fairly quickly. You can't say we're going to use this money and then go out and fundraise to do other things. You just won't be able to satisfy that within the 12-month period of the grant. Okay. So many great questions. We are just not going to get to all of them. I'd like to toss this question to both Amanda and Alyssa. Please provide examples of the state-community relationships that need to be in place for this program. Do either of you like to offer some examples? Alyssa, start with you.
Peter, I'm sorry, can you clarify, did you say examples of state and community relationships or activities, yes, or both?
Yes, state-community relationships that need to be in place for this program. Probably speaking to the earlier condition where we said that, you know, if you don't already have relationships in place, you probably can't get them in place by the time this grant would expire.
Sure. Yeah, so this is a great question. And I think this also kind of speaks to, Peter, a point you made earlier on, which is that given that this is a new program, we're not in all counts being extremely prescriptive, because we know that there are projects that are underway that are innovative and that we don't know all of the examples. What I will say is that, again, to underscore that we are looking for existing projects that are beyond the conceptual early stages. So for instance, we're not looking to fund work that is based on theory at this point in early planning stages where you don't have that relationship already between the community collaboration and a member of state government or members of state government. And so obviously at this point, you'll have already been partnering with the partners that are at the table in such a way that the funding through LAPP is intended to advance that work beyond what you currently have. So if there's a specific issue that has come up that you are thinking about right now that you could, you know, leverage those funds to further advance, that is what we're looking for this project specifically. And so in terms of activities that may include doing some data systems mapping where you have an already existing project, but you're looking to advance the functionality of the data system, or adding an additional data source from a new sector, or you've jumped in on the work, but now want to go back and make sure, you know, is our governance model equitable for the information sharing that we want to achieve together? Do we have all of the policies in place at this point? And, you know, is there an opportunity right now to engage community members in ways that we haven't done before, but we feel are important, and we want to center our work around our community members as full partners in this. And so those are, I think, some examples of what folks can be thinking about, but again, not an exhaustive list. And let me stop there and see if Amanda has additional thoughts that she wouldn't mind sharing.
Yeah, so that's great, Alyssa. And I think in pointing folks on the call back to the brochure, can't do that enough. There is a section in there, and this is right before you learn more about the awards. I think this is on page 4. And one of the things that we did as part of the LAPP development process was we had some very strategic conversations with some thought leaders that have been identified across the organizations at the federal level, at the regulatory side, at the data side, at the state side, communities, persons in communities. And there is some reference there into the areas where we noted either critical enablers that existed, some of the shift out of the barriers. But there were a number of different project examples that we were presented with who were able to sort of point out some of the key elements that might take their existing project and the existing relationship and either overcome a hurdle or elevate it or sort of escalate it to a wider swath and incorporate more sort of meaningful outcomes that they could direct with a more cohesive effort with some funding. So you'll see on that page 4 reference to some of those considerations, like how to do technology mapping or how to access some of the data use agreements, some of the things that you may have had them in place or your project may have had them in place, but now you're looking to expand that work and address some of the challenges you faced. And there's a good list there that will give you some insight as to when you're thinking about the stage of your project and where it is in relationship to what you want to do with the grant funding. These are the types of complexities that you're ideally having had addressed already, or maybe these are some of the components that are still missing. So it should give you some confidence as far as where you're at in the project and where we foresee that being a fit for the lab.
Thanks, Amanda, and thanks, Alyssa. I'm seeing a question here about our requirement for a community engagement process. And so let me just read this requirement. It says, a specific community engagement process for involving persons with lived experience and or community residents as a part of the planning, execution, and evaluation of the use case or intervention. And the question is, our existing community collaboration does not meet this requirement. Is it acceptable to begin this process now and still be eligible? And so let me just reflect that this requirement is somewhat aspirational in that it's very much in the dynamics of this work that we're understanding how crucial it is to engage people with lived experience and community voice in the process. And so the requirement under the eligibility criteria is that during the time of the grant that you have an ongoing process that is meaningful and can be documented. Ideally, you already have some of those relationships in place and you're building on them. But we did write the language for this, is that your application has to include a process. And so this really becomes, if you can articulate the process that you will use for your application, you'll meet the eligibility criteria. But then within the selection criteria, we talk about a history of partnering with members of the community who share lived and learned experience. And so for community collaborations that already have some experience there, can already document the meaningful ways in which people with lived experience are engaged, that will be points in their favor. So the answer is the process needs to be a part of your application. Priority will be given to folks who are building on existing relationships. All right, I'm continuing to cherry pick the question that I can answer, and I'm sorry that the answer is no, but we do have criteria here when you say state government, can this also be local city government partnerships? The local city government partnerships only count if they are involved with some aspect of state government. This program, the LAPP program, is pointed towards state government and local collaborations. And so that is our focus. If your project only involves local city government partnerships, you might consider applying to the DASH KIT cohort program, which is available now. I'm going to take one final question, and then we're going to move to the end of this webinar. Let me just say thank you. Your questions are amazing and complex, and I don't want to be one voice answering them without gathering our team together and responding to the ones that require more nuance than we can just do off the cuff. Will a program officer be available to further answer questions from organizations considering to submit an application? And so let me just say, absolutely, that is the function that we'll describe in just a second. We are unable to respond to your very specific question. Is this project a good idea? Is this likely to be funded? We're not able to answer questions like that, but we will answer every question that is asked of us and be as specific as we can. As both I said and as Amanda said, we will typically point you to the brochure and the frequently asked questions, but we will answer every question. And with that, I want to send it to Amanda, who's going to wrap us up.
Sure. So Susan, take a look at the last two slides for me. There you go. So just one more time to reiterate, I'm getting a lot of echo. Peter, can you mute your? Thank you. So the LAPP homepage is on our DASH website, so dashconnect.org/LAPP. There is a link to the online application system. There was a link to join the webinar. You'll have an access to the recording of today's webinar as well as to the slides. The FAQs, as Peter mentioned, we'll get together and get those ready for you by Wednesday the 28th. And there's also information on how to send questions or inquiries to info@dashconnect.org, making sure you use the subject line LAPP program. And so last but not least, I would say that the most important links, Susan, last slide, please. Thank you. Would just be here. So I don't think we could place these in any more spots, so they're readily available. And just one other note on this slide is that DASH cannot guarantee answers to questions after December 4th. You'll remember that the deadline for the LAPP application is December 16th at 3:30 Eastern time. And so please make sure if you have questions that you direct those again to info@dashconnect.org with the subject line LAPP program, and that you get those to us by December 4th. And again, the link to the online application system for RWJF is here, as well as in the brochure, on the slides, and on the homepage. So thank you very much for joining today. We really appreciate your time and willingness to learn more about our project. We're thrilled at the opportunity and look forward to seeing all of your submissions, and just really excited at all the energy and work going on in the space around community and state partnerships and involving those with lived and learned experience, and really continuing to stay the course on moving the needle around health, equity, and well-being, and making impacts for sustainable change to policy and systems, learning from these opportunities and outcomes from the project. So thank you very much.
Thanks, everyone. As you leave the webinar, you'll be invited to take a 4-question survey. That will really help us if you do that. And with that, we'll shut it down and look forward to seeing you on the FAQs.